Welcome to the Using the Whole Whale podcast, where we learn from leaders about new ideas and digital strategies making a difference in the social impact world. This podcast is a proud production of Whole Whale, a B Corp digital agency. Thank you for joining us. Now, let's go learn something. This week on the Nonprofit news feed, we've got some new news, but also I'm just proud because hopefully we sound better. We are trying out some new software to make the quality of this podcast better because, frankly, we believe in iteratively getting marginally better, fewer mistakes, doing our best every week. So hopefully we sound a bit better as we bring you news that sometimes is uplifting. I feel like we've been on some weird trends recently, Nick. I am excited, though, because there was a big announcement about blood donations and some shifts coming.
Yes, George, I'll take us to our top story, and that is, as you said, the news that the FDA has announced that they are going to ease restrictions on gay men and blood donation eligibility. So this past Friday, the FDA proposed the new policy with revisions that demonstrate a shift toward more inclusive regulations surrounding blood donations for members of the LGBTQ plus community and those of other sexual orientations. This is reported by CNBC and many other outlets. In 2015, the lifetime ban on gay men from donating blood was eased somewhat to allow those who abstain from sex for 1 year to donate blood. But Friday's announcement proposed easing those restrictions even further. The long-time restrictive blood donation rules, again, which it's announced have been eased a bit, have long been criticized as discriminatory by organizations like the Human Rights Campaign and other organizations, which say this new announcement is a step in the right direction, but there's still a way to go. The new rules would allow monogamous, gay, and bisexual men to donate blood, while folks engaging in sex with new or multiple partners must wait 3 months. Pretty crazy. This is how long it took to get here. Still a ways to go, but we know that blood donation and community blood drives touches on a lot of similar themes and organizations, particularly related to community health and nonprofits that work in community health. So we wanted to bring this story to the forefront.
Yeah, like you said, it's quick check. It's 2023, and it's amazing if you're looking at how, frankly, homophobic originally that this really, the genesis of this concern dates back to the AIDS epidemic and the misunderstandings inherent there. So in addition, it's great because, blood shortages, blood donations being needed nationally, regionally, and especially when we come in and out of moments of disaster and crisis. So it is it also helping, I think, in the national blood shortages that we episodically see. So good news.
Absolutely. This is good news all around. We hope that there's additional progress is made on this issue, but a welcome announcement for sure. All right, I can take us into our next story, and this is kind of a funky source for us. This one comes from state.gov, courtesy of the U.S. Department of State. And this was a press release celebrating a program that has a lot of implications regarding global efforts to combat HIV/AIDS. So on January 28th was the 20th anniversary of the U.S. President's Emergency Plan for AIDS Relief, which is commonly known as PEPFAR, that was started under the Bush administration. So PEPFAR is largely considered to be one of the most successful international health intervention programs within the international development space, to be implemented not just by the US, but by anyone, anywhere. The 20 years of the program has really helped, a lot of analysts say, combat HIV/AIDS, particularly in Africa and on the African continent. Um, 2 decades later, PEPFAR has supported nearly 65 million people with HIV treatment and testing services and provides more than 20 million men, women, and children with life saving antiretroviral treatment, or ART. And to build on the program's enduring legacy, the State Department and PEPFAR are attempting to reinvigorate the U.S. global response to end the HIV/AIDS pandemic by 2030. And I will say, when you look at the origins of this, it was definitely came of a different time, right? Bush administration. There was actually some like abstinence only education that was kind of controversial that was in there that eventually got legally excluded permanently, um, but has done a tremendous amount and was really a whole of government effort. It was the State Department, it was the Department of Commerce, it was the Department of Defense, it was Peace Corps volunteers on the ground, it was nonprofit and NGO implementing partners. It was a really, really collaborative kind of interdisciplinary project here, of course, as well facilitated by USAID. So just one of a in a world of bad news. Sometimes it feels like a good news story worth celebrating that we actually are, of course, with lots of collaboration, able to tackle big issues. And I think that this is one example of a time that the world has tackled a big issue and made a difference.
Really impressive also seeing that, they're trying to set a target of ending the HIV/AIDS pandemic as a public health threat by 2030. And, as a reminder, I think the word pandemic has a deeper meaning, I think, for all of us now. And considering that this, I think, officially came on the scenes in 1981, it sort of gives you the idea of how long we may be in uh, a global focus now, seeing that they support nearly 65 million folks across the world with HIV/AIDS as part of this program, which is very impressive with HIV treatment and testing services.
Absolutely. Phenomenal program. And we hope to see it achieve even more in the coming years. All right. I'll take us into our next story. And if you are fans of The Daily from the New York Times, of course, the eponymous podcast, this is a story for you. I will say, as heard first on nonprofitnewsfeed.com and the nonprofit newsfeed podcast feed, but The Daily has finally caught up to us and issued a podcast episode of their own called How Nonprofit Hospitals Put Profits Over Patients. The episode's hosted by Sabrina Tavernisi and talks about nonprofit hospitals, which make up half of hospitals in the United States, many of which were founded to help the poor. Really kind of emphasize how these hospitals have deviated from their public good missions and values, essentially operate like for-profit businesses, charging absurd rates and really failing some of the communities and poorer patients that they serve. So really worth a listen. Times most of what we talked about on this podcast was from journalists at the New York Times, and we love them. They've been really pulling the thread on this in a great way. But cool to listen to this story that really, really highlights this complicated issue and just kind of how broad and how important an issue this is and needs to be talked about more. Like, this needs to be reformed.
I'll say this is not complicated, actually. If you have an operating 501c3 for public benefit hospital, there is a requirement that for the folks that fall below a certain poverty threshold, you cover their services. You don't harass them for payment. You don't harass them for payment at the bedside. Some of these stories are really depressing. And they're, I think they were a little light on it, but as accusations, Providence, which had a hospital system that they said recently merged with a nonprofit hospital, they hired McKinsey and Company. So McKinsey and Company, the consulting firm, McKinsey and Company then came up with the plan to get patients to fork over money. I'm quoting here, and they called it Rev Up, as in revenue up. nonprofit focused consulting agency, I think there is an interesting amount of attention that could be paid to who consults in these moments and saying, is it a honest, correct thing to advise a nonprofit to maximize revenue in the face of mission? And they got one line, and so the story moved on. I found that interesting. I found that very interesting. In terms of maximizing revenue, no, we maximize impact. Consultants that work in the industry should remember uh, that there is a double bottom line. And honestly, I hope more ink is spent on practices that promote predatory behavior toward income constrained communities. It frustrates me. It is frustrating because there's not just one actor here. There are a bunch of folks trying to be really clever at the expense of a community. So we've had debt on the podcast to speak about how they approach large medical debt. If this, I'll say, if this frustrates you, go to that organization and look at the fact that you could turn $1 into $100 of medical debt relief for individuals struggling under this system. So channel the rage, write a check. Maybe I'll go pause and go do that right now.
Yeah, George, I feel your rage as well. And this dovetails with the other thread we've been following, which was the nursing strike in New York City. Nurses at nonprofit hospitals advocating for, yes, better pay, but primarily advocating for more staff to do their jobs well, right? And hospitals are so laser focused on profit and margins that nurses who say that they feel that they are dangerously understaffed are being ignored. And those strikes worked, resolved. They were able to negotiate. It affects real people. It affects real communities, and yeah, hopefully, it's good to see reporting from the Times keep the ball moving on this. But that's one ball going up against a really steep incline. The American hospital industrial complex, as you were. So we'll see what happens.
Well, another point here, I want to be fair that I don't mean that like all nonprofits should not have a profit or not be able to pay their staff enough or not have income generating activities. By all means, I will jump to the front of the line and champion that. Absolutely do that. But before you sort of bring out the world's smallest violin in this moment, right? And cry for this organization. Like they had 27 billion. Providence had 20 in revenue. This is not a small organization, and they're not paying tax when you're a nonprofit. So, mind you, I'd say in this level of conversation for nonprofit hospitals, I'm finding a hard case to find the other side.
I'm with you, George. Hopefully, we have good news to report in the near future, but a big problem that's going to take a big solution over a long time. But what is a solution that already exists that can really help people very directly is the SNAP program. So our next story comes from Gothamist, and this article is titled SNAP food stamp payments are about to get smaller and New Jersey lawmakers want to fund the difference. So SNAP is the Supplemental Nutrition Assistance Program run by the federal government, aka food stamps, and it helps people buy food at supermarkets. And it was increased during the pandemic as part of pandemic funds that really helped people. It also helped mitigate some of the challenges due to rising food costs, but it's about to expire, except lawmakers in New Jersey are looking to potentially actually use state funds to extend the increased benefits from the pandemic era SNAP increases, which I think is really innovative and really clever problem and public policy to extend programs like this. And I think we wanted to bring this to your attention because some of these programs, the SNAP program, um, like this is public policy that works. And we love talking about public private partnerships on nonprofits and communities. And um, food assistance is an all hands on effort problem that needs an all hands on deck approach. And it's, yeah, I think an important story because I know a lot of nonprofits touch on this, but wanted to highlight it here. George, what are your thoughts around this?
Yeah, I think food stamp programs are up there for most efficacious in terms of helping an audience because that the direct connect between, hey, here's money for food, essentially, vital, vital nutrients for families that are, struggling to make ends meet. And by the way, while the pandemic may be winding down, the inflation is winding up, right? The general cost of living has increased, which is a holdover, hangover, pandemic effect of what we did to the economy to, bridge that gap. And I think, we're going to be paying attention to stories like these where I believe current timeline is sometime in the next 6 months where the Biden administration will be making an announcement that we are, officially out of the emergency phase of the pandemic, may give the excuse of cutting some programs. Maybe some should be cut, but I think others that are serving lower income communities should be preserved, especially in a time of inflation. So I worry a little bit about sort of taking the emergency moniker off of some of the assistance programs and giving the excuse to cut back where maybe we shouldn't, uh, and support programs like food stamp assistance. In my college days, I was in Philly, and I actually worked with a group that registered people for food stamps, and would walk through line item. Like I would sit there, and I was approaching folks, being like, "Hey, would you want to apply for food stamps?" And we would go through their budgets, and it was shocking. Like this is not something that is being handed out on the street. You have to go through a pretty rigorous application process, actually, in that day at the very least, and also is very real when you're looking at raw numbers of like you make this much and food costs that much and rent costs that much. Like there's very very thin margins that folks are who apply for food stamps living on, and so these numbers seem small. Oh, we're reducing it from $95 down to 50. Like those are that's the difference of a number of meals right there. So I'm a fan of food stamp programs because I believe it supplements in a supportive way.
Yeah, George, I absolutely agree with you. We've talked about as well, like apps that help people access um, various benefits related to food. One well taken that it's a very real, very human problem and a very effective policy intervention. Um, so we'll continue to follow that program and see what happens out of New Jersey. Um, George, how about a feel good story?
Ooh, what do we got?
All right. This one comes from, okay, I'm going to say this wrong. The mountaintimes.com that inexplicably has Watauga Democrat.com in its domain name. Anyhow, it is an article about the annual High County Canine Keg Pull. Has returned to the Appalachian Mountain Brewery for its 10th anniversary to raise money for the Partners! Canine nonprofit. The event was held last Saturday. And I think this is awesome. Supporting dog rescue nonprofits like Partners Canines and their shelter, which has helped more than 10,000 dogs since 2007. And the model is that for every beer purchased, $1 will get donated to help dogs in need. And we love to see that. Never a more noble reason to drink lots of beer on a Saturday afternoon.
Yeah. Again, that's the 10th annual High Country Canine Keg Pull. I just wanted to say that actually. What a great name. Perfect. But the organization did and has over 10,000 canines. So this is uh, good to support an actual nonprofit doing actual work for local shelters. Nick, I've got a question for you.
Uh-huh.
I know you're excited. Why did the nonprofit Million Tree Planting Project fail?
Oh, I don't know.
It was too shady.
It's too shady.
Because
That's like
the trees make shade.